Hello all, welcome to Lemon Tricks, where concepts are made easy. Today we are going to learn the remaining topics from the unit Introduction to Health and Illness from the subject Nursing Foundation 1. First, let us look into the causes of illness. Illness is a result from disease, and we know disease is a pathological process. Most health problems have different or multiple causative factors. It can be many things like life situation, environment, and many others. So, no disease is ever caused by a single factor. So, there may be multiple factors, causative agents, which can lead to illness and disease. So, now let us see what are the causes of illness. So, it is of two types: physiological causes and psychological causes. The first physiological cause is physical trauma. So, this can also be referred as physical injuries. So, these are the injuries, those can be caused by some mechanical trauma or due to any heat and cold or due to any electrical shock, and it also can be the changes in pressure and radiation. All this can result in physical injuries that can thereby result in illness. The second one is disease of biotic origin. So here the biotic agents are the living organisms, that may be virus, bacteria, or any other organisms or microbes that causes illness or disease in a human body. Third one is the abnormal growth of cells. So the diseases which are arising from uncontrolled cell growth. So this is the most common cause of human death. So there are two types of tumors or two types of uncontrolled cell growth, which is referred to as malignant or benign. And this is also called as neoplasm, means new growth. So this can also be a reason for illness or disease. And the last one is the chemical injury. So in simple, it can be called as poisoning. So a poison is a substance that can cause illness and also sometimes death when ingested. The first physiological cause is physical trauma. So this can also be referred as physical injuries. So these are the injuries, those can be caused by some mechanical trauma or due to any heat and cold or due to any electrical shock, and it also can be the changes in pressure and radiation. All this can result in physical injuries that can thereby result in illness. The second one is disease of biotic origin. So here the biotic agents are the living organisms, that may be virus, bacteria, or any other organisms or microbes that causes illness or disease in a human body. Third one is the abnormal growth of cells. So the diseases which are arising from uncontrolled cell growth. So this is the most common cause of human death. So there are two types of tumors or two types of uncontrolled cell growth, which is referred to as malignant or benign. And this is also called as neoplasm, means new growth. So this can also be a reason for illness or disease. And the last one is the chemical injury. So in simple, it can be called as poisoning. So a poison is a substance that can cause illness and also sometimes death when ingested. So the next one is the psychological causes. So under the psychological causes, the first one is the genetics or the hereditary. Mental illness sometimes runs in families, and this can be inherited from one generation to another generation. It may be due to the interaction of multiple genes and also some other factors like stress or any abuse or any traumatic event that can lead to illness. And the second one is the life experiences. So the life experiences include any childhood trauma, which might be an emotional, physical, or sexual abuse too. And it might be due to a loss of a parent or a divorce of parents, neglect from family members, poor ability to socialize with others, feeling of inadequacy, loneliness, anger, anxiety. All these life experience can also lead a person into illness. And some other factors like change in job or schools and or any other social or cultural expectation that a person cannot meet, and also substance abuse by the person can also lead that person into a illness. Other factors like poor nutrition, exposure to toxins, and certain infections that are linked to brain damage and developmental factors can worsen the symptoms of illness. And also we can add brain defects or injuries also in the psychological causes. Any defects or injuries in certain areas of brain are also linked with some mental illness. And another important factor that comes under the life experiences is the prenatal damage. So any evidence that suggests there is a early fetal brain development or disruption in the early fetal brain development or trauma at the time of birth can also lead to the psychological factors that causes illness. And the next one is the neurotic disorder. Stressors, especially in childhood and adolescence period, can also lead to illness. And also high stress index. So the stress also plays a major role in leading to illness, right? So here people or students or children who are exposed to high stress are also prone to illness. And the next one is the psychotic disorders. The main cause for psychotic disorders are like schizophrenia, bipolar disorder, that can be due to genetics and also due to many other additional factors like drugs and other stressors, external and internal stressors. So all this falls or comes under psychological causes. Next, let us see what are the risk factors of illness. So a risk factor means anything that increases the exposure of the individual or community to an illness or an accident. It means something which can worsen the illness. So here the risk factors are again divided into two types: non-modifiable risk factors and modifiable risk factors. So by the term we can understand non-modifiable risk factors are those that cannot be controlled or changed. And whereas modifiable risk factors are those that you can control or that you or I can change. Now let us look into these risk factors in detail. The first non-modifiable risk factor is the age. Age is a major factor that determines the risk for disease. Children and elderly are more prone for contracting illness compared to that of adults. If you see newborns and infants, they are more prone for infections and accidents. The second factor is gender. So gender is considered as a untreatable and non-modifiable risk factor. If you see women who are above 55 years of age, they are more prone to disease than men. And whereas male gender, they are more associated with infections following trauma or accidents. The third factor is the genetic factor, or we can call it as a family history. When considering risk factors for chronic disease like diabetes, heart disease, family history is often included, and this is mostly included under the non-modifiable risk factor, suggesting that family health history cannot be changed. It doesn't mean that having family history of some disease will get you that disease. For some condition, knowing about your family history might encourage you to change your lifestyle, quit smoking, do more exercise, that can lower the risk for acquiring those conditions. Now let us look into the modifiable risk factors. The first modifiable risk factor is the physiological factor. So here it is nothing but the physical functioning of the body. How well our body functions. For example, obesity. It places increased stress on the body and that can directly or indirectly lead to illness. So that can be modified by doing proper exercise, controlling diet or maintaining balanced diet. And the second factor is the environment. The environment in which an individual lives determines how he eats, lives, works, and so on. So if that person is exposed to polluted air, that can lead to many lung diseases. If that person is working in a chemical industry, that can lead to many occupational disease. Apart from that, the environment that leads to stress, suppression, negative thoughts, fear, lack of love, lack of joy, and lack of desire to live, lack of physical activity, all these environmental factors can also lead to illness. And the third one is the lifestyle. Lifestyle practices affect the health positively or negatively. So the practices which have negative outcome are called as risk factors. So those factors may be poor lifestyle, environmental factors, unhealthy diet, exposure to toxins, exposure to microorganisms, and unpleasant life situations. And another important risk factor under this lifestyle is stress that leads to development of many diseases and can seriously affect the mental health of a person. And the fourth one is the dietary habits. Poor dietary choices can lead to undernutrition and sometimes overnutrition. Diet which is deficit in essential nutrients can affect many biochemical processes inside our body. So proper dietary management helps us to modify or update or help us to carry on with good lifestyle. And the other factors are like economic status, deficiency, diseases are more common in people who are in low socioeconomic group, and also people who face stress in the society due to many other societal factors can also lead that person into illness. And apart from that, many other factors like spiritual factors, immunological factors, inadequate services and facilities available can also lead to illness. Now let us look into illness behavior. So the illness is divided into two types, acute illness and chronic illness. So acute illness is the one which has a short duration and is mostly severe. It starts suddenly and subsides quickly. So whereas chronic illness, it lasts for more than 6 months and maybe it affects the functioning of the body system in any dimension and also can lead to a level of disability. So here illness behavior means the way the sick person acts is called as illness behavior, or how the sick person behave, that is called as illness behavior. Different people will act in different way, maybe to the same type of illness. It involves how they interpret the disease or how they view the symptoms, how they use the treatment modalities to cure their disease. All this lies under this illness behavior. So here there is a model, or this model describes about 5 stages of illness behavior. This was given by Edward Suchman. So he stated that there are 5 stages where a person who is exposed to illness will show in the form of his or her behavior. In that, the first stage is experiences symptoms. So in stage 1, the client will experience the symptoms of the disease. So the client here believes that something is wrong and he or she experiences physical symptoms and also expresses it in the form of emotional response. He or she may try to consult others, friends or colleagues, and may try some home remedies or self-medication in this stage 1. So the stage 1 is experiences symptoms. The second stage is assumption of the sick role. Now the client seeks confirmation from family and friends and continues with his own treatment. Now he tries to excuse himself from the normal duties and expectations where he needs rest, and he continues with the treatment. Now the third stage is called as medical care contact. Now the person or the client tries to seek advice from the medical professionals to confirm or validate his illness, and he or she tries to get explanation about the illness in his own understandable terms. He gets reassurance and the treatment plan. Here in this stage, he may accept or deny the diagnosis. And coming to the stage 4, now the client enters the dependent client role. Now the client becomes dependent on the professional help on like nurses or doctors or any other family members for help. and stage 5 is the recovery or the rehabilitation stage. In this stage, he tries to come out of that dependent role and try to resume his roles and responsibilities. Now he tries to adjust himself in case he has entered into the stage of disability. These are the 5 stages where the person who is exposed to illness faces. Now let us see what are the impact of illness on patient and family. The first impact is on their behavioral and emotional change. So illness always puts patient under stress. Especially behavioral and emotional reactions will depend on the nature of the illness or the diagnosis of the client. Hearing a diagnosis of serious illness like cancer may take a patient into a stage of shock, denial, and withdrawal. So here the nurse should assist the client as well as the family to cope up with the stress. So the nurse can also call their spiritual leaders or any other support people to come and help the client to overcome this emotional change. And here the nurse should act as a counselor and help the patient as well as the family to cope up with the diagnosis. And the second impact will be upon the family dynamics. So the illness brings additional stress if the client is the breadwinner of the family, or if the client is the source, brings the source of income to the family, then financial problems may be an additional burden to the family. So here the role reversal should occur, like any other family member should take up the responsibility of the client, maybe an elder child or sibling or parent. So this family adjustment may take time, but the nurse has to guide them or give them proper guidance of not putting burden over the client that can only lead to additional stress. So here the family dynamics changes. So it is always important for the family to make decision in a way that supports the patient or the client. And the next impact will be upon the self-concept and self-esteem of the patient. Here self-concept means how a person views himself, right, about his strengths and weakness. So here when a person is diagnosed with some serious illness, they may question their self-worth or whether they could do anything in the future with this illness. So that affects the self-esteem of a person too. So the self-concept of a client will completely change when he is diagnosed with some serious illness. So he may not be able to perform as per the family expectations, right? So it will affect the interaction with the family members also. So the nurse should observe all these changes in the client as well as in the family members and help them to overcome this change. And the last impact is on the body image. Certain illness result not only in emotional, behavioral or in the self-esteem changes, but also in the physical appearance of the client. So clients react differently to these changes depending upon the type of change. If it is a short-term change, they can readily accept it. But if it is a permanent change like amputation of a limb or permanent colostomy, they may enter into a stage of shock, withdrawal and all. So here we have to put additional, we have to take additional measures in order to help the client to overcome this physical change or to accept that disability in the rehabilitative phase. So this is all about Introduction to Health and Illness unit. If you found this video useful, kindly like, share and subscribe. Stay connected for more clear concepts. Thank you for watching.